Hello everyone. So we have started our discussion about abnormal uterine bleeding in our previous video, and our concluding point was the classification of the causes of abnormal uterine bleeding, that is palm-Cohen classification. So for the mnemonic palm-Cohen, P stands for polyps, A for adenomyosis, L for leiomyoma, M for malignancy and hyperplasia, C was for coagulopathy, O for ovulatory dysfunction, E was for endometrial causes, I for iatrogenic causes, and N for the causes that are not classified yet. So today we will be discussing AUB-P, that is abnormal uterine bleeding due to polyps in particular. I would request you to watch these videos in series sequence, as that would give a better understanding about the topic. So if you have not watched the previous video, which was the introduction of abnormal uterine bleeding, then please consider watching it. So polyps, which are one of the major causes of abnormal uterine bleeding, are nothing but benign outgrowth of epithelium with a vascular core. One of the major causes for the formation of polyps is considered to be unopposed estrogen exposure. As we know that the endometrium is dependent on estrogen for its proliferation, so the exposure of endometrium to unopposed estrogen without the stabilizing action of progesterone is the major cause of development of polyps. The estrogen excess can occur due to anovulatory cycles. So as we know that after ovulation, corpus luteum secretes progesterone, which takes over in the further preparation of the endometrium, and the sudden withdrawal of progesterone leads to bleeding. But when there is no ovulation, there is no progesterone to balance the action of estrogen. Hence, the endometrium keeps on proliferating, predisposing it to the formation of polyps. Other causes of estrogen excess include medications such as tamoxifen or hormone replacement therapy. Even obesity is one major reason of estrogen excess in the body, which could further predispose polyp formation. So polyps can be endometrial polyps, which is in the inside of the uterus and formed as a result of the overgrowth of the endometrium, that is the inner lining of the uterus. They are attached to the endometrium by a thin stalk or a broad base and extended inward into your uterus and have a vascular core, that is blood vessel inside. Next we have endocervical polyps that grow in the cervical canal and are the most common types of polyps. They usually occur in premenopausal women. They typically arise from the cervical glands in the cervix. Next is ectocervical polyps, which are more common in postmenopausal women and arise from the outer surface layer cells of the cervix within the ectocervix. So the abnormal uterine bleeding with polyps can usually occur due to torsion of the polyps, leading to ischemia of the base of the polyps, surface ulceration or inflammation of the polyps, or even due to infection of the polyps. Let us go through the clinical presentation of polyps. Although we know the fact that polyps can cause abnormal uterine bleeding, it is most of the times asymptomatic, and when it becomes symptomatic, it typically and very particularly causes intermenstrual bleeding. One thing to remember is intermenstrual bleeding is a characteristic feature of uterine polyps. That is, the woman may have a normal menstrual cycle but will have episodes of bleeding in between. Polyps also cause heavy menstrual bleeding and bleeding after menopause. In case of infected cervical polyps, there may also be foul-smelling pus-like discharge, and the woman may also have bleeding after sexual intercourse. It can also adversely affect the fertility of a woman. So now let us see what are the investigations done to diagnose polyps. Ultrasound will guide us roughly towards the diagnosis of polyps. It reveals thick and irregular endometrium, and with color Doppler study, we can see the blood vessels in the polyps showing features of the feeding vessel sign. However, this does not lead us to a definitive diagnosis as it does not distinctly demarcate the polypoidal mass. So, for better visualization, we can use a saline infusion sonography or a sonohysterography where the saline is filled in the uterine cavity, which appears black on sonography and helps to demarcate the polypoidal growth better. The gold standard investigation for endometrial polyps is hysteroscopy, which not only helps to diagnose better, but also helps us to differentiate polyps from uterine fibroids. And again, it has both diagnostic and therapeutic benefits as it allows hysteroscopic resection, that means removal of the polyps in the same setting. So, hysteroscopy followed by histopathological examination of the resected tissue will help us arrive into a final conclusion on our diagnosis of polyps. So, stay tuned, everyone, as we will be continuing with the discussion of abnormal uterine bleeding in our upcoming videos. Do consider to like, share, and subscribe to the channel if this information was useful to you, and follow me on Instagram for more such helpful health related topics. Thank you.